So Tuesday has, I think, a very extensive spinal pain. Now what we don't know is exactly how long lasting this is, but it seems to be rather more acute. So I'm hopeful, given that we'll get a pretty powerful and long-acting response. The sooner any treatment, be it conventional or Eastern medicine, whatever treatment is given, the sooner in the disease process, the more likely we are to get a positive response. I think the owners will notice an improved mobility in the cat. Perhaps they'll just notice that she's around more often, not sleeping around on the sofa so much.
This girl.
So how old is she?
She's 10.
She's young to be having all these issues.
Migraines and things, yes I know.
Oh.
So I saw her, I think last night, and she was...
She's happy to be patted. Yeah.
Yeah, but her skin ripples and her...
Oh, ow. Ow, wow. Okay, ow. Okay.
And up here as well, yeah, so...
Oh dear.
I wasn't sure whether she'd done a disc in her neck or...
She's very... Okay.
It was very tense. And they've noticed that she likes to sit with her head on a book or something, or on an arm, so that her neck was a bit extended. She's a really lovely cat.
Oh dear. Alright. So I have here a 10-year-old cat which has been diagnosed previously and treated for hypothyroidism. It seems to be a friendly cat, happy to be patted, but showing marked hyperesthesia of most of the spine, especially the base of the neck and the thoracolumbar junction and down in the sacrolumbar area. So I've given this cat a combination of 0.3 ml ketamine, 0.3 Valium, IV. This should give me sufficient time for what I wish to do. I place the cat in ventral recumbency, so I've got it nice and even. And I start with the back bladder points and associated muscle and bone points. Just put my head into a natural position. I'll also do some points around the base of the skull, which are more associated for neck pain, given that it's the marked sign in this cat. I find this treatment works quite well to reduce the spasm that the animals feel. Also, a tricep injection helps to reduce the spasm associated with the neck. The tricep becomes extremely tight in animals with cats with neck problems. Now I'm just going to do the back points. Mostly, I'm going to maximise my therapy where the points I notice the greatest discomfort. So that's the neck, the thoracolumbar junction, and then down into the sacral area.
The G20, is that a pain relieving spot or just a sedating spot?
I think a sedating spot more. I just inject a small quantity of the solution. even under sedation, you can feel the cat spasm as some of these needles go in. I also do a bow away point there, and I'll just go a little bit lower than normal. Western medicine doesn't suggest that pain in this area is significant, but certainly we see a significant improvement in the animals when we treat the lower sacral points. And now we'll get a little bit more solution and put our cat on the side. Stop filming, I think, now for a moment. I'll just see a bit more. As you can see, the cat's colour stays very pink. This combination is very good for maintaining blood pressure and oxygenation, though we have oxygen only 2 meters away if we need it. I'm now going to treat some general leg points.
Hold the foot up.
I think it might be right. These are the classic lower hind leg points for back pain. And used in any acupuncture treatment for this type of condition. And this sedation is very short. We've been well under 10 minutes, and the cat is starting to recover slightly. So I might get you to hold that leg out since he's just starting to feel it. Okay, that's right now. I need to relax the leg this one. What I also like to do with these cats is to give them a good manipulation of the spine, because they've probably been holding themselves extremely stiff for a very long time, and so it gives me a chance to just make sure that everything does move all right. This cat has probably not done this sort of motion for some time, I'm suggesting, with such obvious discomfort along the spine. It is still quite flexible. We don't in cats tend to see the back stiffen up to the point that it doesn't bend like we do with dogs, but clearly this cat would have spent a lot of time sitting in a very hunched position, and so it's probably going to appreciate the opportunity to have a good bend. Perhaps we do some sort of chiropractic thing in the meantime, inadvertently.
The Valium is also useful at getting rid of the spasm.
Yes, the Valium has relieved the muscle spasm for me, and I think that gives me a good opportunity. There's significant spasm in the neck in this animal, so it's a bit unfortunate. Given the fact it's on treatment for chronic bowel disease, it does make the addition of non-steroidal anti-inflammatories difficult in this cat. But this is relieving, and I can feel a significant reduction in the tension in the tricep muscle, which I'll give a good massage to as well. Oh, they're tight. Even though they've had the needle in them, they're still very tight.
We used to say cats didn't get spinal disorders.
Oh my God.
Yeah, I mean, I remember I was taught that. But of course, now we know that 30% of cats have arthritis of spinal or joint areas by the age of 3 and 90% by 10. So if you pay attention to how the cat shows arthritis as opposed to how dogs or people do, it's quite
The signs are more subtle in cats because cats are generally less active, so you tend not to, people don't notice the cat having difficulty rising, for example, or something like that, which they would notice with a dog. I noticed when we were holding the cat to anaesthetise or sedate it, it seemed to be in pain with the legs, and I wouldn't be at all surprised if it's got arthritis of the elbows as well. Oh dear. So he's starting to recover, starting to lick, so significant spasming still in this tricep of the left foreleg.
Right foreleg.
Sorry, right foreleg, yes. This might be something the owner could do to gently stimulate this muscle, just to see if a little bit of massaging of it helps to keep the spasm at bay. Just give them a little general massage down the spine.
I might put her on a bit of Valium along with her cortisone for a couple of days. Just no. Just let it. Just get them to have her move around a bit more.
Yeah, maybe encourage her to move. And I would encourage them to gently play with the tricep, particularly on the right here, to see if it's as obvious. Doesn't seem as obvious on the left. Oh yes, it's similar. So that might be helpful for this cat too. Though they have to do that very gently, because some cats find that quite painful.
So you're massaging the point.
Just ask them to just grasp the actual muscle itself between thumb and forefingers up here, and just gently massage it. I don't want to overstimulate it now. All right, so she's about to wake up, so I think we'll put her away.
I'll just wrap her up. I'm taking to keeping them in their own carriers.
Oh yes,
they panic less.
I find that too.
There's a girl. We'll turn you into a little. In America, they're calling this the burrito wrap.
Oh yes.
There's a girl. This is Tuesday, and she's just had her acupuncture sedative. You can see she's quite alert. She's got it all figured out again. She's quite worried about what I'm doing. I think she's anticipating pain rather than feeling it, and certainly she's recovered from the sedative very well. There's a girl. She's not sitting in that hunched, I'm so unhappy position that she was earlier today. She's now using her back muscles, and her neck is moving better. There's a girl.